I think an idea that's emerging from these conversations is that the arts break barriers, and that also means the arts build bridges. And this panel will shine a light on some remarkable community organizations in and around Skid Row in LA, the Urban Voices Project and Clinical Care Connections. Our moderator will be Shavonda Weber-Christmas, Director of Community Benefits at the LA Care Health Plan. We'll also hear from panelists, 3 of them, who are leaders of the Urban Voices Project, and you'll hear all about that. Christopher Mack, Community Outreach Consultant with the Wesley Health Center, co-founder of Urban Voices. Kate Richards-Geller is the Executive Director of the Urban Voices Project, and Leeav Sofer is co-founder and Artistic Director of the Urban Voices Project. We'll also hear from Renee Smith, Director of Advancement for the Los Angeles Christian Health Centers. Thank you.
Hello, my name is Shavonda Weber-Christmas, and I am a child of music and song and poetry. I grew up to pursue a career in public health, and I work currently in a health plan at the intersection of health, wellness, and philanthropy. I've built a portfolio that is steeped in equity and understands the importance of the arts in centering and creating health and wellness. With me today, I have 4 individuals who are uniquely partnered together to promote arts and health. First, Kate Richards-Geller. She is the Executive Director of Urban Voices Project, and she holds a master's in music therapy, and that came from New York University, NYU, and she is the co-founder of Inspired Music Play and a board member at National Alliance for Music in Vulnerable Communities, Skid Row Arts Alliance, and regularly participates in convenings of arts and Homeless International. Next to her is Renee Smith. She's the Director of Advancement at LA Christian Health Centers, where she runs the Urban Voices Project Neighborhood Sing at the Joshua House, where she actually built from the ground up through a capital fund project that she spearheaded, and to this day continues to partner with Urban Voices through that project. Also next to her is Christopher Mack, co-founder of Urban Voices Project, and he is the Senior Community Outreach Consultant at Wesley Health Centers, which is also known as JWCH, where he's worked for over 23 years. He's deeply respected presence in the Skid Row area, and he is known by many as the urban sage. Lastly, but not least, is Leeav Sofer. He is the Artistic Director of Urban Voices Project, and he's currently on faculty at the Colburn School of Music, and he teaches classes, directs choirs, and community engagement programs there. He holds a degree in performance clarinet and voice, and he has performed at venues such as the Walt Disney Concert Hall, the Ford Amphitheater, and the Staples Center. And he proudly performs on 7th and Wall at the Joshua House of Blues. Thank you all for joining me today, and welcome. So we're here to talk about Urban Voices Project and Clinical Care Connections. And so I want to just go through a few questions with you all and answer as you will, to kind of highlight how Urban Voices Project works with clinical and social service organizations to bring health and inspire folks with the arts. So first up, let's talk about how Urban Voices Project primarily focuses on people who are enduring homelessness. What keeps your singers coming and involved long term? And for our clinic representatives, how does the choir help stabilize the medical care of each of these individuals?
I can start, and I'll just say that Urban Voices Project, we first started as a community choir, and that was it. And it was Christopher and Mack and myself, and we had this famous line. He said, if you bring the music, I'll bring the people. And he already was marching, as you heard, the urban stage. He's marching around Skid Row, gladly singing at the top of his voice everywhere he goes, so everyone knows he has a song in his heart. Whether it was, but also Chris, just started his training as a musician later, so he was singing for the love of singing. And when he met me as a music teacher, he even asked me for lessons, and he's been a student of mine. But my point is that as he goes out and sings on the street, he started combining his work of asking people if they want to sign up for healthcare, but also, do you like to sing? That was the most basic approach. But what's developed now, 10 years later or more, is we have programs that serve at different levels. And there are people that are the tent community that on the street, and at that level we have open mic, we call it our Busk Fest, open mic programs out on the sidewalk. And we do that right on 5th and San Pedro, where people can come out of the encampments and walk past the way and just jump in with a jam or a song. And then we also are partnering with clinics, partnering with social service centers, as you said. We also partner with libraries, too. But our Dear Clinic relationship is on 7th and Wall currently with the Joshua House Clinic with LACHC. We have the ability to be able to have people that might be coming in for healthcare getting to hear the music down the hall. And so all of a sudden you have people that might be in turmoil down on the street level. They can catch us when we're outside. People that are just starting to get into a place of a little bit of transition into stability, and they're seeing us there, as well as programs that can be drop-in friendly or programs that take commitment and allow people to engage in their own journey, long-term journey of health and wellness. So I guess my point is we have so many programs now that can meet all different levels of people that are going through homelessness, whether it's street, transitional, or even those that are in permanent housing but just need continued support.
That's beautiful, and that's just a wonderful way that people can connect no matter where they are in life. Any others want to add to that?
When we first started, people have to understand that the condition of homelessness, it varies in three ways of observing it. The tents, which is what Leeav was alluding to. Some people are in tents, and some people are in transitional housing, which is the shelters. You have your Union Rescue Mission, you have the LA Mission, you have the Weingart Center, and you have permanent supportive housing, which is ran by the SRO and Skid Row Housing Trust. So you're actually dealing with people that are in different stages of what the country knows as homelessness when they talk about the area. So you're talking about the geographical area, but you're also talking about an ecosystem. And we're able to touch each and every one of those people because we give them an opportunity to go inside. Leeav was talking about what's not broken. Every person has something called pure potential. And sometimes they forget that potential. And so Urban Voices Project is giving them the opportunity to go inside of themselves and to express that.
Joshua House Health Center was just opened in 2023, and brand new 24,000 square foot state-of-the-art clinic in Skid Row. And mostly because people deserve quality care. And among the core components of quality care in this community is trust and community. And so having Urban Voices Project in our clinic every week, week after week, really makes us a part of community and builds trust, because people know when they come in, they're seen. You know, one of the components also of caring for people who may be suffering through homelessness is being seen and being heard. So I think that our partnership in that, it helps our clinical care because we want to see people. We need to get our hands and our eyes on them as often as possible. So it just increases the odds that people are not only going to come in and sing, but maybe they're going to show up for their follow-up visit to check on their diabetes, or to get their blood pressure checked, or to pick up their medicine at the pharmacy. So it makes a lot of sense for us because it is a different way of serving people. We're not just a one-stop spot. When you walk through the doors of Joshua House, there's community, there's healing, there's optometry, there's medical care, there's social services, there are connections to housing even. So it makes a lot of sense for us, and I think that it's been a tremendous and bold step for our clinic even to invest what we've invested. I'd love to make more of an investment in it. I think Leeav and I have talked in the past about the dream of our providers being able to write a script for someone to go sing. Like, you know, we think you should go sing for a few, go join the community choir. Like, that should be part of the prescription for healing and wellness for folks.
Hear, hear.
Well, the good news about that is there is, in fact, a movement afoot in this country. It's already happening in other places in the world, but social prescribing is a real thing. It's more than nutrition. It's more than just transportation to clinic visits. Now, more than ever in this world of arts and health, we're looking at the ways that joining in community, historically, people join in community, whether it's in the arts, a dance class, a choir, a sports team. People are joining in community, and it impacts it has a positive impact on people's health outcomes. And so more and more research is being done right now, University of Florida and also UCLA. These research labs are very specifically showing us how this is research-based. And I think this is definitely one of the very unique things about Urban Voices Project is that it's really that bringing together of arts and health, so bringing people into the clinic to sing, and they're motivated to come in and sing because music makes people feel better. It allows the clinicians also to come in and sing with and the arts become a vehicle for this trusted messenger, what you're saying, Renee. People will trust the music and the arts, and then while they're there and they're feeling better and they want to continue feeling better, then they can make those appointments. So every week, a representative from Joshua House comes in and speaks to the community that's gathered there and lets them know of the services that they can get because we're in the clinic.
There's just so much value that is rendered because of the physical connection between the arts, the artist, and the health centers. So that's beautiful. Thank you for sharing that. I do want to explore a little bit in terms of choir members and how the arts and being in the health space assist them with both their own healing and also their clinical care and how they are actually able to improve their health.
There's 3 levels. I've taught so many things in 3s. First, of course, you hear a lot about the self, and the way that music therapy is mental health, and it supports transformation, and chemicals are being released. We've heard a lot of that, and it's fascinating in group work because we do community singing focused programs. They're group programs. What's also, in my vision, to be addressed as part of your health is your network, your relationships. And half the reason why people fall into homelessness in the first place is the lack of a safety network, the lack of the people to catch you when things go bad. And I will just happily comment that our system's not great at doing that as a country. Said it, I'll stand by it. But my point is that most people, if they fall on hard times, it's moving back in with your parents. It's leaning on a family member, a cousin, a friend. You're sleeping on a couch before you're going to any sort of system for help. And the healing here is that you're healing your network, you're healing your relationships, you're healing the ability to trust, as Renee said, not only practitioners, but also and service providers, but trust just people in general and your fellow members. I mean, how many people that are going through the worst of it, they find that their only group meetings are AA or NA or some kind of support group that, once again, going back to what we've said, focuses on the brokenness of a person, that focuses on, hey, by the way, you have an addiction, I have an addiction, we should be friends. But my point is that here you can come into a circle that actually says, you love music, I love music. And it no longer labels you as anything other than someone that just loves art and music. And all of a sudden, your friendship is built off of something with a different level of integrity and dignity as a human. And now, what you find is a choir member will tell another choir member, oh my God, we love the same artist, and you'll talk for 45 minutes about music, but then at the end, they can say, what is it that you need? Oh, well, I have to go show up at the courthouse tomorrow because my license was stolen, or my ID. And they're like, guess what? I know which courthouse room you need to go to. I'll take you for coffee in the morning, and I'll take you there. There's peer advocacy help from choir member to choir member 10 times more than there is even from the staff or service providers, because that's sometimes where it all starts, to heal relationships.
Wonderful.
So really, part of having a community and being in a community is that we don't realize that the condition of homelessness produces isolation. And so Urban Voices, as a community, begins to deal with that. It begins to heal that part. See, isolation is one of those silent things that people carry around with them because they don't want to be seen, because somebody told them, you're dirty, you're unwashed, you're unclean, you know, you should be doing something else. And so it creates isolation. And in that isolation, the only antidote really is community. And so when you have some place that you can go where there's non-judgmental, where there is this compassion and this empathy and this seeing you as you are, you know, a beautiful individual that has a voice.
And how does seeing oneself as connected and a beautiful individual that has something to contribute, how does that change their own energy, the way they show up in the world?
You know, I think that it means that you show up for yourself. It means you care when something's bothering you in your mouth and you want to go see a dentist. I think it means that you're going to look after yourself. And I would be remiss if I didn't mention that this theme of trust and being invisible, you know, we're having this summit virtually. You know, we're recording this because of the events that are happening related to ICE raids and protests here in downtown Los Angeles. And this week I had a chance to go with our street team to just look after patients to see what's happening. And among the people that we encountered were a couple of folks who were undocumented and expressed how afraid they've been in these last weeks and why they've been staying away, but also appreciative of the team that was walking around to just check their vitals, people who they see every week, whether they're coming into the clinic or not, but they are part of a network of community which really helps us to see each other, you know. And I think besides being there every week, but then having music attached to the connections that we have to each other, not only impacts the patients, but it also, you know, impacts our staff. You know, it's not an easy thing to come to 7th and Wall, also known as Fentanyl Row, to come and look after the health of people and to see people in different conditions. So walking in to sing with patients, with people who are experiencing homelessness and trying and holding on really for dear life to each other and to holding on to each other to be lifted up is, you know, part of really the gift of being a staff member there and being a part of the community too.
Literally, together we rise.
Yes.
Yeah.
Yeah, one of the songs we sing is, you guys sing is, take what you need.
Ah,
Take all of what you need. And I think that's also kind of rooted in Leeav's talk about we can connect with each other based on our assets, right? We want to, I love to talk about asset-based community building.
Yes.
And this is what we're doing here with this work.
Beautiful. And another thing I just want to address, because you brought it up so beautifully, is that there is this natural element of music, listening to music, making music together, that has a neurological impact. And when we can engage in music, we can be in music together, just for this moment, we can interrupt the fear cycle. And just getting that moment of respite from that fear cycle that many of us find ourselves in right now, we can have a music experience instead, and that allows the whole nervous system to down-regulate just for that period of time. That's important in terms of building resilience and the long-term survival during challenging times like this.
That's so powerful. Yes, Chris.
I'm also able to see it ignites the confidence of the individual. And so when you have an individual who was in that state of isolation, who actually starts to utilize confidence in himself, and that's one of the ways that it has impacted the individual. Now he's got agency, his own agency. It's not something that's given to him. It's just something that's ignited and turned back on.
Yes, absolutely. So I want to go one more question, and then we'll start to close out. And this is related to how the design of your program actually, and the structure that you all use in your classes, helps to strengthen participants and the audience's experiences and the effect that's had on them.
The program in itself has two huge parts of Urban Voices Project. We started as a community choir, but we are also hearing, especially what we're referring to at Joshua House of Blues, is a workshop program, which is called Neighborhood Sing. But what's going on now is that we have two sides of this beautiful world that we do. We have this outreach, the face of the work, which is the choir, where we get to perform for audiences, and I'll speak to that in a moment. And then we have the workshops, which we like to call the heart of the work. And the heart is where we are doing so much of this important connection to clinics and connection to building that safety network and having that neurological change happen. But this last part, we're not just healing ourselves or healing the relationships of group. The way we try to heal society and the way we try to heal on an even bigger world is the choir. And this choir still performs. It still goes to audiences to help change narrative. And it does that, it reclaims it, because it humanizes an individual that's up here creating art. It personalizes it for you, because you're not seeing someone on stage because they've gone through homelessness. You're seeing someone on stage because they have art in them, an expression. So while this choir goes out and it changes, you mentioned it, how we change audience, we also try not to perform. We try to really get people singing. If you ever come to a choir performance, you'll always hear this line: the two most feared words in all live performance, audience participation. And we kind of say that on repeat, because by the end of the concert, we're all singing together and we're just in a circle. And the point of that, whether it's in our performances or in our festivals or in any space, or between, service provider and client, it's just this universal language that completely levels the playing field. And if we can sing shoulder to shoulder, we can even bring communities shoulder to shoulder. And I just want to say one last thing on this as I ramble here, but I once went to a new program where they had this huge group of volunteers who come every Sunday for a Sunday supper program. And the volunteers had me come to visit the people that they serve, and they give meals every Sunday. And I came there to just talk to the people there and see if they're interested in a music program. And I immediately started sitting down at the tables and talking to people, and they looked at me with shock, and they're like, "You just had 20-minute-long conversations with people that won't even give us a one-word answer. How did you do that?" And I was like, "Well, what do you say to them?" And they say, "Well, we go up to them and we say, well, what is it that you need? What is it that you need?" And I'm like, to a point, we do say, take what you need. But I think what first I say to them is, what music do you like? Yeah. And all of a sudden, the person is not responding to this, again, perpetuated us and them. They're responding to the fact that you see me, as just someone who likes to listen to this radio station versus that radio station. And it's so humanizing. Yes. So I think that releases the tension of a person to then allow us 20 minutes later to be saying, by the way, I have a resource for you if you need me to connect you. So I just want to say that, like, teaching ourselves to, I missed a little bit of the context at the beginning of this question, but whether it be audience or whether it be participant, I just wanted to speak to both faces of the choir outreach as well as the workshop transformations that happen.
One of the things I learned in music therapy as well was that music is how we can build rapport with people, and that's so essential, whether it's in a clinical context or just any context. Way that we can connect with people, as Leeav just said, is through music, talking about the favorite song, about all the aspects of art as a way to make that bridge, to connect with each other. And the other piece that we've designed in Urban Voices Project, programming specifically, has been also in response to these three different levels that we've talked about, response to community expressed needs. They tell us they want to learn music. We create music education classes. They want to learn how to manage anxiety and the many things that they're dealing with. We create music wellness classes. So music wellness is something that has actually been a bunch of practices that has actually come up very specifically in response to what people have asked that they need. So using music to address our minds and our bodies and change what we need to change to get through the next moment.
And I'm just going to make a short button on that. I just want to say the community-driven committees, we do town halls to get that. What do you need? How does this program be your program and build it for you? That's how we definitely like to function. That's all. I just want to say that.
Thank you for adding that. I know that there's always a line at the end of Kate's messages that says listening. And I think that's so valuable because no matter what it points you to, hear everyone, not just those that are loudest or those who are out in front, but everyone. And I know we need to wrap up right now, so I'm going to turn us to the intrinsic purposes and how this has affected each one of you. So as we close, just thinking about those who might be watching, who might be curious, what will they get out of this? What's in it for me? Not in a selfish way, but how can they connect to something like this? What have you found this space has changed for you, or your artistic space, or your clinical practice, or your approach to providing quality care?
I think I'll start just because you offered that beautiful intro, listening. I think listening deeply, listening and noticing what's happening within my own self, calming my own nervous system so that I can be present for the moment, learning how to pause and not react, to learning about listening for who I need to be in this moment, not what do I need to do to fix something, but how can I just be present in this moment and trust. I trust music to guide me in that. That's been the biggest lesson for me.
For me personally, my role in the clinic is really, I boil it down to showcasing, collecting, and sharing stories that inspire people to get involved, to give, to volunteer, to see their appointments. And for me, the engagement with Urban Voices Project has really helped me to be in closer relationship with those stories and opens my heart to seeing the whole person, to see the beauty of people, to hear that beauty. And also just, the songs that when you walk into a workshop, the songs just hit me, and because music moves me. I love music. Music is what I use to be inspired to go out and ask people to give money. You're right. So that's what it's done for me.
Thank you.
Time.
Time.
Listen louder than you sing.
I'll just say this has become my identity. Art not for the sake of art, but for the sake of something else. And I'm going to take this last 10 seconds to say, if you want to get involved, those that are watching this, and want to learn how to be a resource to move this work, find us on urbanvoicesproject.org, whether it's through funds and through time and through a capacity or just as audience. It all means a lot to us.
Thank you all so much for being here, for sharing your hearts, for sharing your music. And I really value having this opportunity to support you all here and continue to support you all as a funder. And I hope that all of you will also join us in supporting Urban Voices Project. Thank you all.
Thank you, Shavonda.
Thank you,
Thank you,
Shavonda.
Thank you, Shavonda.